point. I think on the particular question, is the MMR vaccine linked to autism? On that question, I think there's a number of studies that in my mind show pretty convincingly that it is not linked to autism. But on the broader vaccine questions, why does the United States have vaccines that we don't give in Sweden, we don't give in Switzerland, we don't give in Germany? Our vaccine schedule is more aggressive. There are differences across countries. Are there side effects of vaccines that we might be missing or underappreciating? Is there more work that needs to be done to optimize vaccine safety and efficacy? On this sort of global question, I think RFK Jr. has an important point. As you know, Megyn, in this country, there were two safety signals from COVID-19 vaccines that we talked a lot about. One was the one you mentioned, myocarditis. The other was something called thrombocytopenic thrombosis that occurred with the Johnson & Johnson and AstraZeneca vaccines. Those safety signals were not first discovered in the United States. Our CDC was not the first one to tell us about it. The myocarditis signal came from the Israelis. They told us about it, and then Rochelle Walensky denied seeing the signal. You can check the Reuters news story, I believe it is April 27th. The United States' vaccine surveillance safety system is old, it's antiquated, it's not very good. There could be many other safety signals for vaccines we are missing. Robert F. Kennedy Jr. has a unique opportunity to revive this system, to rehabilitate it, to make a new modern system where we actually take seriously vaccine safety and we actually try to study it. And you're not going to find safety signals if you're not looking for safety signals. I think that's an important problem. The other thing I'd say is that there's a pushback to Robert F. Kennedy that anytime you look for safety concerns for vaccine, you're anti-vaccine. That's not true. Anybody who prescribes any drug product, of which a vaccine is one, knows that a good doctor always considers side effects, always considers that other side. And the last thing I'd say is, I've listened to him. I think that people are fear-mongering. If he comes into power, the MMR vaccine is not going to disappear from the hospital shelves. He's a big believer in vaccine autonomy. So he will likely try to reduce coercive pressure to have the current vaccination schedule. But I don't think he's going to take away any vaccines. I don't think changing that 1986 litigation law is going to make them manufacturers not make them. I think these kind of fear-mongering stories that vaccines will disappear, I think that's incorrect. So I think that while he's wrong on MMR and autism, I think he might have a broader point about we should take safety more seriously.